Well, welcome everybody. Welcome to Best Cares from A to Zinc, Understanding Vitamins in Your Daily Life. I would like to introduce Dr. Chastity Caston. She is a graduate of the University of Mississippi School of Pharmacy, and she is currently doing her residency at MBMC, so Mississippi Baptist. She supports medication therapy management, transitions of care, and community pharmacy operations. And she really focuses on chronic disease management, particularly hypertension, diabetes, and heart failure. So a warm welcome to you, Dr. Caston. We really are appreciative of your time today. Thank you. And we will hold questions. If you want to put your questions in the chat, go ahead as she goes through it, and then we will get to answering questions at the end. Thank you.
All right. Thank you for that beautiful introduction. So again, good afternoon, everyone. Thank you for joining. I am Chastity Caston, a PGY1 community-based pharmacy resident at the Mississippi Baptist Medical Center in Jackson, Mississippi. And so today we're just going to talk a little bit about vitamins and supplements and how they fit into your daily life, especially when you're taking medications.
Hey, I think you're muted, Dr. Caston. I think it went into mute.
Uh-oh.
There you go. You're good now.
All right, let's start over. All right, good afternoon, everyone. Thank you for joining me. I am Chastity Caston, a PGY1 community-based pharmacy resident at the Mississippi Baptist Medical Center in Jackson, Mississippi. And so today we're just going to talk a little bit about how vitamins and supplements fit into your health and daily life, especially when you're taking medications. So here's what we'll cover today. So by the end of this presentation, you should be able to interpret the differences between medications, supplements, and vitamins, identify some of the most common drug-induced nutrient depletions, as well as explain the pharmacist's role in helping patients choose these supplements wisely. So let's start off with a quick chat check-in. If you're comfortable, share in the chat if you take any kind of vitamins or supplements regularly. Okay. Someone says vitamin D. Multivitamins. Vitamin K. Okay. Turmeric. I have tried, but the side effects have made me stop. Right. I see a lot of you are taking a lot of supplements here. So in the next few slides, I'll be discussing the differences between medications, vitamins, and supplements. All right, so medications are used to treat or manage specific health conditions, and they go through strict testing through the FDA to prove their safety and efficacy. While vitamins more so support the general health by providing nutrients. So they're not held to the same regulatory standards, and manufacturers can't really claim to treat or cure diseases. So that's why it's imperative to choose these supplements wisely. So vitamins are one category of dietary supplements that are found in fruit, vegetables, and other foods that you may consume, while the supplements can also include minerals, herbs, amino acids, and more. And so these supplements are meant to add more of a nutritional value to your diet, but they aren't meant to replace any food or medications. And so I've included some examples here. Again, I saw in the chat a lot of you said that you take vitamin D, and then over here to my right is just the energy supplement that has some of those nutrients that we'll talk about later on in the slide. So there are certain times when supplements can really make a difference, specifically when medications affect how your body is absorbing or retaining your nutrients. So, for example, some drugs like diuretics or acid reflux reducers can deplete key nutrients like magnesium, potassium, or vitamin B12, which again we'll cover later. And over time, this can lead to certain symptoms that you may experience. So in these cases, supplementation helps you restore the balance that your body needs by simply putting back whatever nutrients that the medication may have taken away. It's also helpful when the body is under stress or recovering from any illness or healing after a surgery or any long-term treatment. Supporting your organ function is also crucial, especially organs like your liver, your kidneys, and your stomach, which is important since these organs are often affected by the medications that we take on a daily basis. And another key benefit is again immune support. So maybe after a round of antibiotics or during a period of physical or emotional stress, your body may need the extra nutrients to bounce back. Now, I do want to point out that not everyone needs every supplement. So it's easy to get caught up in trends and end up with a shelf full of vitamins, but that doesn't mean that they're all necessary or helpful for you. So that's why it's very important to personalize your approach. So again, sometimes medications can interfere with how your body is absorbing or storing your nutrients, and this isn't always obvious, but over time, it can lead to real deficiencies that affect how you feel and function on a daily basis. So these depletions occur because certain drugs block the absorption in your gut. They can increase how fast nutrients is leaving your body, as well as even change how your body is using the nutrients. So some of the most common ones we see are calcium, coenzyme Q10, folic acid, magnesium, potassium, thiamine, vitamin A, vitamin B12, vitamin D, vitamin K, and and zinc. So when these nutrients drop too low, you may experience certain symptoms like muscle weakness, mood change, or even more serious issues if it's not addressed in a timely manner. So it's very important to routinely assess for potential depletion. So um, attending those doctor's appointments for them to obtain labs is very crucial. So let's look at some examples of medications that can deplete nutrients and what symptoms might show up. So I won't go into too much detail, but just to hit the highlights so you can get a sense of what nutrients might be at risk and what to look out for. So calcium can be depleted by some of your anti-seizure medications like phenytoin or carbamazepine, as well as your steroids like prednisone. We also see that what they're called the H2 blockers, famotidine, things like that that are used for acid reflux producers can deplete your calcium as well as some of the diuretics that you see. So the torsemide, furosemide. And so when your calcium levels are low, you may experience muscle cramps or even bone loss over time. Coenzyme Q10 is often reduced by the cholesterol-lowering medications. So this is a pretty common one, which is atorvastatin, simvastatin, rosuvastatin, or even some of your tricyclic antidepressants is known as amitriptyline. So low coenzyme Q levels can cause fatigue, muscle weakness, and even increased blood pressure. So that's something to look out for there. And with folic acid, so also known as vitamin B9, it can be affected again by those anti-seizure medications. Even birth control pills will affect this. Metformin that is used for diabetes, methotrexate, some of the pancreatic enzymes like creon, or even Bactrim. And so again, a deficiency in that can lead to fatigue, headaches, irritability, as well as shortness of breath. Magnesium can be depleted by estrogens, acid reflux producers like omeprazole, or even some diuretics. So that's often linked to high blood pressure, increased stroke risk, as well as plaque buildup in your arteries. And the last one on this slide is potassium. So it can be lowered by, again, those steroids and some of the diuretics that you're taking for fluid. When potassium drops, it can cause muscle weakness and irregular heartbeat. So that can become very dangerous. So that's something to look out for there. So this slide is just continuing with a few more nutrients that can be affected by those medications. So again, medications like furosemide and hydrochlorothiazide, those diuretics can lower your thiamine levels and lead to fatigue and even tingling and burning in your hands, known as neuropathy. Vitamin A and vitamin K are often reduced by those cholesterol-lowering medications like your bile acid secretions known as cholestyramine. Low vitamin A can lead to poor night vision, and low vitamin K can increase your risk of bleeding. So this is really important to look out for, especially if you're on blood thinners. For your vitamin B12, it's depleted by metformin, which is a very common one there, and some of those acid reflux producers. And so low B12 levels can lead to fatigue, nerve pain, and even some memory problems. Vitamin D can drop when taking, again, anti-seizure medication. So we're seeing a trend here. A lot of the cholesterol lowering medications, acid reflux producers. So you may notice some bone pain, muscle weakness, or even frequent infections due to a weakened immune system. And lastly, medications like, again, famotidine, furosemide, torsemide, those diuretics can reduce your zinc levels. So signs of low zinc levels would include slow wound healing, changes in your taste or smell, and more frequent cold or infections. So just recognizing these drug nutrient interactions can allow us to catch any deficiencies early and consider supplementation when necessary. So again, a lot of you already, I guess I'll skip this because a lot of you guys did mention a lot of the ones that you were taking in the chat. Like I said, I see elderberry, turmeric, ginger, magnesium, things like that. So we'll move right along. So before we go any further, it's important to understand what the recommended dietary allowance or RDA is and what it actually means. So an RDA is the average daily amount of nutrient that most healthy individuals need to meet their nutritional requirements. And so it's often set by health experts to help prevent any deficiencies or promote long-term health. And these values are really based on age, sex, and life stage. So, for example, adults over 70 may experience more calcium, may need more calcium or vitamin D than younger adults since they're more prone to bone fractures. And so, this is not typically a strict limit or a goal to exceed, but just think of it kind of as a baseline level to aim for through your diet or any supplements if you're taking them. And so by understanding the RDA, we give the body what it needs to stay strong and function well. So we can let's try to keep this in mind as we go throughout the next few slides. So coenzyme Q10, so the first one we'll talk about today, is an essential enzyme that is involved in energy production. So it plays a key role in your heart and your muscles. And so one key clinical point is that the coenzyme Q levels are often depleted by those statins that I talked about for cholesterol lowering, atorvastatin or rosuvastatin. And so this can lead to statin-induced myopathy. So that would be the muscle pains, muscle weakness that you may feel once you begin treatment. So supplementation with coenzyme Q10 has been shown to help in some cases. So typical recommended doses range from 100 to 600 milligrams a day for 1 to 3 months, depending on your severity of your symptoms or your clinical response. And so it's important to monitor patients and yourself if you are consuming this for improvement, and you can just make sure to adjust your dose as needed. Coenzyme Q is generally well tolerated and may offer a supportive benefit for those patients. So it's just something to keep in mind. All right, so calcium and vitamin D work together to support strong and healthy bones. So calcium is essential for proper bone development as well as maintaining your bone strength throughout life. And then we have vitamin D that plays a key role in helping the body absorb calcium efficiently and supporting bone growth. And so the RDA for calcium is 1,000 milligrams per day for adults aged 19 to 50, and for men aged 51 to 70. Whereas for women over the age of 50 and adults over the age of 70, the RDA recommendation increases to 1,200 milligrams per day due to the increased risk of bone loss. And for vitamin D, the RDA is 15 micrograms or 600 IU for adults aged 19 to 70. And after the age of 70, that recommendation then increases to 20 micrograms or 800 IU to help maintain bone density. And so some food sources, um, for those would be, for calcium would be milk, yogurt, cheese, a lot of the leafy greens like broccoli, kale, and then salmon. For vitamin D, those natural sources would include fatty fish like salmon, tuna, trout, and other fish liver oils. And some dairy and plant-based products are also fortified with vitamin D as well. So potassium and magnesium are also very two essential minerals that play a critical role in your overall health. Potassium is vital for maintaining proper nerve function and muscle contraction, as well as fluid balance in your body. So um, the recommended dietary allowance for potassium is 3,400 milligrams per day for men, and then 2,600 milligrams for women starting at the age of 19. Then moving along to magnesium, on the other hand, is involved in a lot of the nerve transmission and energy production, as well as your body regulating its temperature. For magnesium, the RDA is based on age and gender. For adults aged 19 to 30, is 400 milligrams per day for men, 310 milligrams for women. And then for those individuals aged 30 and older, their recommendation increases slightly to 420 milligrams for our men and 320 for women. So some good food sources for potassium, again, milk, tea, coffee, soybeans, potatoes, things of that sort. And then for the magnesium, we see spinach, legumes, seeds, nuts, and whole grains. Moving right along to folic acid and vitamin B12. So there are both B vitamins that play a critical role in the body's ability to make healthy red blood cells and support overall cell function. So folic acid is essential for red blood cell formation, healthy cell growth, and it's essential also for early pregnancy. It helps reduce the risk of serious birth defects. And so the RDA for adults 19 and older would be 400 micrograms of dietary folate equivalents and then for pregnant women, that increases to 600 micrograms to support that developing baby. For vitamin B12 is vital again for development of your central nervous system and the red blood cell formation. So that RDA is 2.4 micrograms per day for adults. And so unlike folic acid, which is found in a variety of plant and animal foods, B12 is typically only found in a lot of animal-based foods. So vegetarians and older adults tend to be at high risk for deficiency there. Good food sources for folate: dark green leafy vegetables, fruit, beans, peas. And then B12 is found in a lot of meats, fish, eggs, and dairy products. And so these two nutrients work hand in hand to maintain healthy blood and nerve cells. So we're going to move on to supplements here. So when it comes to multivitamins, so I saw in the chat that a lot of you guys do take multivitamins. Um, the formulations are often tailored to different nutritional needs of men and women. So the women's multivitamins would typically include irons, especially for those premenopausal women due to monthly blood loss. And they often contain folate, which supports, again, that reproductive health. Together, those nutrients may support bone health, reproductive health, and hormonal health. And then for men, multivitamins, on the other hand, usually contain little to no iron, since generally men don't need that supplementation unless advised by a provider. Instead, they often include zinc, selenium, vitamin D, and a blend of vitamin Bs as well. And so while multivitamins can help fill gaps in your diet, it's important to remember that this is not a one size fits all. Individuals do need to make sure that they are personalizing their approach. And so I did have slides here. I'm not sure why they kind of shifted, but for the men's multivitamins, as you can see, there's no iron here, higher levels of selenium there, again to support prostate health. I think this will we lost. There we go. All right, so for our women's vitamins, as we can see, there are contains higher levels of folate when compared to the men's multivitamins. And then also, if we go down here to again the iron, tend to have more iron than when compared to the men's multivitamins. Just a couple examples to show you guys. So multivitamins designed for adults over the age of 50 are also formulated differently, and that's based off the changing nutritional needs that come with age. So as we get older, the body's ability to absorb certain nutrients that we need decline. So these supplements are often higher in this specific age range. So for women over 50, multivitamins typically include higher levels of biotin, vitamin D, B12, calcium, magnesium, and zinc, while the iron is typically reduced or eliminated since, again, the postmenopausal women usually do not need that extra iron. And these nutrients also help support hair, skin, and nails and address any age-related concerns like blood loss, immune function, or any eye health. And then for the men over the age of 50, they tend to include again those vitamin D, B12, calcium, magnesium, zinc, along with some additional components like lycopene or sulfamicto to help with prostate health. And so again, like the women's formulation, typically not a lot of iron included uh, in those vitamins. All right, so energy support. So supplements marketed for energy support typically include um, vitamin B12, iron, coenzyme Q10, and magnesium. And so together, those nutrients help support with oxygen delivery, energy production, and as well as they're pretty useful in cases of fatigue and stress. So this example here, as you can see, vitamin B12 and coenzyme Q10 that I mentioned earlier included in this formulation. So when talking about immune support, many supplements focus on key vitamins and minerals that are basically there to strengthen the body's natural defenses. So again, some common ingredients would be vitamin C, vitamin D, and zinc, which are essential for supporting white blood cell function and maintaining a healthy immune response. And so, in addition to the core nutrients, many immune blends like some herbal components like elderberry are generally useful for immune health, specifically during cold and flu season. I know here at the pharmacy, we tend to have to order a lot more of those simply because people are coming in trying to purchase. And so those ingredients can kind of help reduce the duration or the severity of your illnesses if taken at the first sign of your symptoms. So when it comes to managing stress, certain supplements are designed to support the mind and the body, and those typically include your B complex vitamins, the ones that I mentioned, B1, B2, B6, and B12. And so they're essential for maintaining energy levels and supporting mood stability. So during times of stress, our bodies tend to use up these vitamins more quickly. And so having adequate levels can really make a difference there. So magnesium is a key nutrient that's often found in stress support supplements. It helps your muscles relax, and it kind of calms your nervous system. So some other natural ingredients is ashwagandha, lemon balm, as well as L-theanine. So those are known to reduce a lot of tension without causing drowsiness. And so these ingredients together will help your body cope better and just handle everyday stress, especially if you're working in a high stress environment. So this slide highlights some of the more popular non-vitamin supplements that many people use for specific health goals. There's pre and probiotics that support digestive and urinary health. For example, probiotics are the live bacteria that help balance the gut microbiome, while the prebiotics are fibers that feed those good bacteria that we have. And so for here, um, a line is commonly used to help with bloating and constipation. And a lot of people tend to use this after taking a course of antibiotics. Um, Melatonin is also used to help with sleep. I know a lot of people who consume that, especially if they're working different work shifts throughout the day. Cinnamon is good as a natural aid for blood sugar control, specifically in people with pre-diabetes or type 2 diabetes. However, I do want to point out the results may vary and high doses may not be safe long term. So something to monitor. Turmeric and ginger are also known for anti-inflammatory properties. Turmeric is often marketed for joint pain and arthritis, while ginger is frequently used for nausea and digestive support. And then last and certainly not least, biotin and collagen are popular in the beauty supplements, specifically for hair, skin, and nails. And so each of these supplements can have benefits, but it's important to consider the quality, dosage, and any potential interactions. So when it comes to vitamins and supplements, it's important to remember that all the things that I mentioned, they should complement a healthy diet, not replace it. So getting nutrients through food is ideal since whole foods typically provide a balanced mix of vitamins and minerals. I also want to note that more is not always better. So taking high doses of certain vitamins or minerals can actually be harmful. So that's why it's very important to use supplements only when there's a specific need or a diagnosed deficiency or restricted diet. And finally, it's always a good idea to consult with a healthcare provider before you start any new supplements. They can help ensure that it's safe and appropriate for your personal health needs. I know we get a lot of patients who come here asking us what would be good vitamins to take with certain medications. So that's something to make sure that you monitor. And to wrap it all up, so pharmacists play a key role in supplement safety. We check for any potential interactions between supplements and prescription medications. And we also help identify any nutrient deficiencies that may arise due to health conditions. And so our goal is to mainly guide patients towards supplements that are supported with clinical evidence and offer some type of benefit. We encourage patients to keep track of how they're feeling after starting any new supplements and to report any symptoms or changes. This helps us adjust recommendations and ensure safe and effective use. So thank you for your time and attention. I hope this gave you a better understanding of how vitamins and supplements work in your daily life. And I'm happy to answer any questions. I do see um, a couple of questions here that I can answer. Let's see.
Do you want me to read them for you?
Yes, please.
Sure. Okay, the first one was, do recommendations go up on vitamin D and calcium if on hormone blockers?
That is a great question. Miss Hollyfield, that is something I would have to look into and get back with you on. If you could just shoot me your contact information, I can look into that and get you some more information on that.
Next is, can you take both calcium and vitamin D?
Yes, you can take both calcium and vitamin D, but you do have to be careful with how much you're consuming. And that's why it's very imperative to attend your wellness visits because, for example, if you go to your provider and they tell you that you're low on vitamin D and you've been taking too much calcium, that's something that you might want to look out for.
Is there an advantage from taking a weekly vitamin D versus a daily?
I think that is particularly, that's personal preference there. Some individuals really like to just go ahead and do weekly so they could just do it that one time and just move on. It's a lot to kind of keep up with every day. So that would be personal preference.
Is oral B12 absorbed well?
Oral B12. Now that um I would have to get some more information on. There are some patients who have come to the pharmacy to purchase vitamin B12, but as far as the absorption and how well is the percentage of the absorption compared to the injections, I would have to look more into that.
Okay, which is best to take, multivitamins or individual vitamins?
So again, that's one of those things that is more a personal preference. Me, I would say multivitamins because they can pretty much have all of the nutrients that you need versus trying to take each individual vitamin. I would just say purchase a multivitamin. You also save a lot of money by just purchasing the multivitamins that have all of those components included.
How do you recommend individualizing your vitamin needs?
Oh, that's a good question. I like that. So I would base individualizing your vitamin needs by looking at any medications that you're taking. So again, those depletions that I talked about, look at any medications that you're taking and seeing what could be depleted by those medications. Secondly, I would look at what is it that you need. If you are someone who is in a high stress environment, then I may recommend stress supplements for you. If you're just lacking on in the energy department and you're feeling like you don't have enough energy to get through the day, then I would recommend your energy supplement. So it's all about looking at what you need and also again consulting with a healthcare provider.
Angela, yes, we are recording this and I will send it out. What is ashwagandha for?
Yeah, so ashwagandha, I know Goli has a product that's basically used for stress. It's known to decrease your cortisol levels, so it helps manage your stress a little better.
What is your opinion on products like athletic greens?
So athletic greens, I would have to look more into that because I'm not familiar with that term, athletic greens. So I would have to look more into that and
Yeah,
get
it's a
back with
brand
you.
name. Yeah,
Oh,
it's a
okay.
brand. Yeah. Okay. What about the use of prebiotics and postbiotics?
Yeah, so kind of what I mentioned earlier in the slides, let's go back. Hold on. So again, your postbiotics are live bacteria to kind of help you balance the bacteria, and then prebiotics are fibers that help feed your good bacteria. And so it's just basically on personal preference. Like this right here is a probiotic, and it's going to basically help you balance out your gut biome.
Okay, these next two are kind of similar. Basically, what is the best way to ensure that the vitamin is a good quality? Do you recommend looking for USP on the labels?
Um, the best way to ensure that the vitamin is a good quality, I would say do your research. Again, these companies cannot really, so it's all going to be up to your preference. A lot of these companies cannot say they can't market themselves as being better than the other. If that makes sense. So it would have to be you doing your research and looking and seeing what reviews, what works, because I mean, some vitamins may work for others that may not work for someone else.
Do gummies work as well as pills?
Yes, I would say, but one thing about the gummies that I will say is a lot of patients do not like the gummies, specifically due to if you have a lot of your oral health is a big role in that as well. A lot of patients say it sticks. A lot of the older patients say that it sticks to their dentures and things like that. So that would be personal preference. A lot of people just go ahead and just do the pill so they can just go ahead and get it on down.
Do you know of any women's one a day that has low biotin?
I would
think I'm.
say I would have to look into that a little bit more. Are you asking about a specific brand?
I think that's what I'm thinking she's
Yeah,
asking.
okay. Yeah, so okay, specific brand.
Yes.
I would say just looking at because I know these right here, the one a day vitamins um that I mentioned, these pretty much have pretty low component of the biotin in there. But you could go to because I know sometimes I'll go to the store and I'll just kind of look and compare ingredients. So I think that'll be beneficial to do just to kind of see well, I want to try these because again, it's a personalized approach.
What if you don't work in a high stress environment, but your body has multiple chronic diseases? Do stress supplements help with that?
It can help. Again, that's the thing with the supplements. I can't tell you that yeah, it's gonna help, but there's a possibility that it could help you. So I don't see anything wrong with you just trying it out, just making sure that it's not any any component in there is not interfering with the medications that you're taking for your disease state.
Okay, we'll do just two more if that's okay with you.
Yeah, that's fine.
Does some of the stress supplements affect blood sugar levels?
Now, um, I would have to look more into that because I did read something on that, but I can send you where I read that information, but I don't want to tell you wrong. I can send you some information. All of these are great questions. Make sure that you shoot me your contact information. Anyone who had a question that I was not able to answer, make sure that you shoot me your question.
Last one. Lots of info in media lately about high cortisol levels, negative weight, and health effects. What is the best vitamin supplement to decrease cortisol?
So I would shoot for ashwagandha, those stress supplements. I think that they really do decrease your cortisol levels and help with stress. Because again, if you are an individual who deals with blood sugar issues, that also can increase your blood sugar as well. So that's something to be mindful of.
Well, thank you so much. This was very informative, and we appreciate all these wonderful questions.
Great questions.
Yeah, thank you so much. And if there's any other topic for Best Cares that you think you would want us to research and find an expert like Dr. Caston on, please send me a message. We really just appreciate you coming. And have a good rest of your week, everybody.
Thank you guys.